So if you're diagnosed with diabetes, should you then immediately be referred to a nephrologist?
No. Most of the time, the kidneys initially will not be affected. And usually the primary care physician will determine whether you need referral to a nephrologist or not.
So how do I know then that I need to go see a doctor?
Well, there are symptoms that can be attributed to diabetes. With the high sugars, you end up with frequent urinations because the sugar induces increased urine flow. That results in being a little dehydrated, so thirst is a major issue. In type 1, actually, since they lack insulin and sugar is the main fuel for our cells, they can't get the fuel inside the cell, so the patients actually are starving. They start losing weight and then being thirsty and urinating quite a bit. In type 2, you don't necessarily lose weight. In fact, most of those patients will be overweight, but you will have increased thirst and increased urination, frequency of urination.
There's always this thinking process, and I remember this too. You have a special drink, monitor your glucose levels for 2 hours, and that helps you tell whether or not you have diabetes. It's a wonderful test that we hear about, but that's not the only one out there.
It's the old glucose tolerance test. However, there's another test, the hemoglobin A1C, which is an average, so to speak. It gives you an average of the sugar levels over the previous 3 months. And normally it's less than 5.5 or so.
What is that A1C number, and how does that run? How does that?
Well, generally, if it's somewhere between 5.5 and 6, you're deemed to be pre-diabetic. Above that, you're most likely diabetic.